Good afternoon, and thank you for the organizers for the opportunity. We know that alcohol, heroin, cannabis, nicotine, they remain to be our priorities, and we have to know what we are doing with these patients. But conditions like eating disorders, emotionally unstable personality traits, which was somewhat prevalent in the West or in other countries, have now slowly, we are seeing here. And just like that, now some of the trends in the substance abuse disorders and the substances that we are seeing is also changing. While alcohol, nicotine, cannabis, they remain to cause the major problems, there are certain other substances that we have to be aware of, just like anorexia and emotionally unstable personality disorders, which are popping up now, and we have to manage them. So alcohol, cannabis, then we are now seeing very much patients with amphetamines, methamphetamine, cocaine use, and so on. And then going beyond comes the new psychoactive substances, or the NPS, which are commonly known as designer drugs, legal highs, bath salts, research drugs, due to many reasons. Now, they're called legal highs quite incorrectly because they are not listed as psychoactive substances in the Convention of Narcotic Drugs or in the 1971 Convention. But what they do is they change the structure of the existing molecule, like the amphetamine or the methamphetamine, and they do a small change, so they are not listed under an illegal substance. So that's why the name the legal highs. But now certain countries are taking steps to stop that, and we'll see what they are as well. So although it says new, they're not really new. They might have been invented some decades ago, but they're coming as psychoactive substances now. So that's why, in a way, they're new. So NPS, I have mentioned that they are not in this list of drugs, so that's why they are called new psychoactive substances. Majority are stimulants, and more than 120 countries are suffering because of this problem, which although it's emerging, because of many factors, which I'll be talking about. By about December 2019, there were more than 950 NPSs that has been reported, and according to United Nations Office of Drug and Crime, about 52 has emerged in year 2022, which is roughly about one per week. And most of the time, these substances mimic the effects of mostly amphetamines, cannabinoids that are available, but with more adverse effects than those. Let's take, this is the amphetamine molecule, and this is an NPS. And what happens is they have done a slight change to the molecule so that the NPS is synthesized. Same with the cannabinoid molecule, THC. The change is done here, so it's not detected in the routinely available substance screening tests that we are doing, but some of the structural properties remain, so they give some of the psychoactive effects, but this small change might cause adverse effects as well, because we don't know. So why are we talking about NPS? Because of the rapidity, because one per week. And they are emerging as legal alternatives. So they might not be screened by the internationally controlled drug mechanisms. And we don't know the adverse health effects. We know amphetamines would cause sympathomimetic actions. These NPSs, if it is a synthetic amphetamine, it is supposed to cause the same actions as the amphetamine, but because of that particular small change, we don't know what that's going to do. And we know with amphetamines and hallucinogens, most of the issues are not because of dependence. a significant amount of issues come up because of the cardiovascular, neurological changes that might take place. And the patients present to us probably with toxic encephalopathies or seizures. And by the time we do the urine substance screening, the urine is clear, because that is one of the last DDs that we would think of. It's the same problem will apply to NPSs. And now, what another challenge is that we do targeted screening. Like, we know what we want to ask for, whether it's cannabis or whether it's diamorphine. We know what to ask, and we know what drug tests are available in the country. And there are new targeted screening, like for gabapentin, pregabalin, tramadol, and oxycodone. But when it comes to NPSs, it has to be non-targeted, because there aren't any specific molecules as such. So from gas chromatometry, now they are moving to liquid chromatography, coupled to high-resolution mass spectrometry, so that they can basically detect the basic molecule. And because of this, monitoring is going to be an issue, and at the rate that they are producing, by the time people detect, the scientists detect the original molecule, another 50 or 60 might have emerged. So that's an issue. And there is a lot of issues about purity and the composition of the products. And the conventional laws that are there, they're not covering these. So some of the countries are actually now going into the changes so that they are actually including the basic molecule structure in their list of illegal drugs, rather than going for cannabinoid or diamorphine, or going for specific drug molecules. So this is how NPSs are seen. So in Sri Lanka, number of NPS reported it falls into 1 to 10 category, and there are about 12 found in Sri Lanka now. And these are the specific groups. So the stimulants, synthetic stimulants, 34%, then synthetic cannabinoids. So these are the two main groups that this NPSs are emerging from. And these are the trends in the Europe. In 2014-15, there was this high, but then it's coming down, but then you could see the cannabinoids, the newer synthetic cannabinoids are again increasing. And how have they seized all these NPSs? When we compare with all substances, there is a proportional increase in the cathinones as well, which is an NPS again. In Sri Lanka, up to 2018, you can see the trend. The cannabis, heroin, they remain high, but methamphetamines, the second generation ones, are also increasing. With that, the other ones are also increasing. And we don't know how much of impurities are there in these methamphetamines that are increasing in Sri Lanka. And also, the total drug-related arrests are increasing. So we don't have really specific data, but we have to correlate it with the arrests from that's the data that's available. So this was a study that was conducted in rehabilitation centers in Sri Lanka among 205. So cannabis, heroin, again, the study replicates the abundance, but then methamphetamine, tramadol, cocaine. So if we assume that rehabilitation centers are representative of what is going on in the community, these other psychoactive substances are also in the rise. And this is the increase in Sri Lanka, the quantity that has been in kilograms that has been seized in Sri Lanka. This is something to show about the impurity levels. So by about 2014, acetaminophen, caffeine, these are the ones which contaminated our heroin. But now, see the list. So that's why I said that even something that is in existence in the past and was synthesized in the past can be used as a novel substance, which might be used as an NPS. And some drugs which are familiar to us, olanzapine, dothapine, prednisolone. So what about the threat of NPS in Sri Lanka? It is there. So 12 known new psychoactive substances are there in Sri Lanka, according to the Dangerous Drug Control Board. And the most commonly found ones are the synthetic cannabinoids and synthetic cathinones, zombie drugs. This is the commonest form out of the cathinones that is found in Sri Lanka. It's cheaper, because we don't have to bring the heroin or the amphetamine per se. Sometimes it might be synthesized in the country itself. Because we do get down certain chemicals for other purposes which can be used to synthesize these medications. And they're coming in very interesting packages, like new preparations are there, like sweets, in crystal forms, in attractive wrappers, sachets, sugar-coated ones, and duloxetine is also available. And as with many of the acts in Sri Lanka, our acts are not up to date with the Mental Health Act and so on. So when other countries are taking steps to counteract these problems, which actually might not be a severe problem as when compared to the other problems we are having, but we have to anticipate, because all the problems that have been started, all the conditions that we have observed in other countries, we have somehow or the other observed them here as well. So that's another issue that we have to look at. There are 4 broad categories of NPS: the stimulant, cannabinoid, hallucinogens, and the depressants. So coca leaf, cocaine, which was there from 1956 to 2000, now it went through a phase when it comes to stimulants where cocaine, amphetamine, methamphetamine was predominating. Now we see NPS stimulants. It increases the serotonin, dopamine, noradrenaline, and therefore the euphoric effect is the psychological effect that we would see. But apart from that, the cardiovascular toxicity, hypertension, hypothermia, the physiological effects are there, which is going to cause trouble mostly, other than the expected and the known psychoactive properties of these medications. And that is why the NPS leads to more acute admissions and acute emergency admissions. And cathinones, because I thought of sharing the photographs and everything, because like it's going to be abundant, that's what is predicted. That is again similar effects to stimulants. Cannabinoids, from herbal cannabis, cannabis resin to cannabis oil, now we've come to the phase where hashish, everything, and then to kush. And when it comes to NPSs, it's the synthetic cannabinoid receptor agonist, which is the synthetic form of the cannabinoids, which is going to be important in the future when we talk of NPSs. And there are the acute effects, the long-term effects, and the other side effects, which might be because of the molecule itself and also because of the impurities that are there. And we do not know the long-term effects. We know what the long-term effects of cannabis is and all that, but then we do not know what the problems with SCRAs are. And I don't think we'll know for a long time, because studies cannot be conducted because of the difficulties in detecting them. Hallucinogens, similar. From the mushrooms, there was a stage where ketamine, ecstasy was there, and now we have come to hallucinogenic NPSs, where there are 2 types, the dissociatives and the ones which do not cause the true hallucinations, and just the perceptual alterations and all the mystical experiences and so on. So again, depending on whether it's a dissociative or the psychedelic drug, it's going to be, the side effect profile is going to be different. And again, physiological symptoms will also be predominant, just like the psychoactive side of it, both of which are very, very important. Benzodiazepines and opiates, the depressants, NPSs. So some of the benzodiazepine, flubromazepam, and all these things which are there, like, the one issue is one of these compounds are available as medicinal drugs as well. So when they use them, it's difficult to control as well. So the tendencies, the morphine, heroin, which was there from 1956 to 2000, now it has come to this, where there are semi-synthetic analogs and the synthetic analogs. And we know what fentanyl is. So that is 50 times stronger than heroin and 100 times than morphine. And the newer ones, like carfentanil, which they're using as NPSs, 10,000 times stronger than morphine. So that's where the risk is. And particularly if they are contaminated, people are actually, with regards to tolerance and everything, we don't know where the tolerance levels are. And they might be taking it as taking it heroin and thinking of the same equivalence. So when it comes to new psychoactive substances, it's everywhere because of different reasons. Because now the original, the raw material, they are becoming difficult to find, so people are trying to replace it, and we don't know what they are replacing it with. And it might be a chemical that is already in existence as a medication or as a substance for something else. So it's everywhere. And it's everything, because a lot of things are involved. Because it doesn't have to be a drug dealer or a person who is doing trafficking. We know some people who produce alcohol in their laboratories. So this is something that can be done as well. So a lot of things are involved, from the chemistry to detection to monitoring to acts. Everything is involved. And everyone, somehow or the other, will be impacted because of this. So that's why we have to be aware. Thank you.